This is a practice guideline for the nurses to identify the instruments during counting. Cynthia is
Hi.
our tech. Okay.
Okay, so we have the sheet and all the instruments on the stringer in order whenever you're counting. So I had taken them off of the stringer. And the first thing we have is we have cryos. They're curved cryos. We use those for tagging things. If there's a bleeder, we'll hold on to it and cauterize it. So we can use those for a bunch of different things. So, but they're curved and there should be 12 of them. The next thing we have are the Alice. And it also is a whole different things. We use those a lot whenever we're testing the patient to see if they're numb. We hold it whenever we're taking out scar revisions, and then holding tissue just to see where the spot is to sew to, different things like that. So these are the Alice. You can see they have a little bit of like pokey things in it, but not super like big teeth. And we have 4 of those. The next thing we have are the Babcocks. We use those for tubals. They're a little bit different than the Alice because they have an opening on them. So we have 2 of those and we call these Babcocks. The next thing we have are the Oshner's. We have 6 of those. 1, 2, 3, 4, 5, 6. We also can be called cokers. They do have bigger teeth on them to hold things like holding up the fascia whenever you're doing things like that, or whenever you're sewing up the muscle, you can hold the tissue or hold the rest of the skin up, different things like that, but they do have big teeth on them.
Okay.
The next thing we have are our different needle holders. We have a 6-inch needle holder that is called the, where is that? Oh, sorry, the CryoWood needle holder, and it's 6-inch. It's just a smaller one. We use it for whenever we're closing like the skin. So with a very small, very small needle.
Okay.
And then the other 2 we have are called the Mayo Hager needle holders, and they're both thicker. So we'll use those for every other needle that we're using for all the other layers. We'll just use the smaller ones for skin. The next thing we have are 4 different scissors. So we have the straight Mayo and the curved Mayo. They're both thicker scissors. This one you just use for like cutting suture and things like that. We usually only use it for cutting suture. And then we have the curved Mayos that you're going to use for cutting tissue, thick tissue, because we also have the Metzenbaums, which are the same kind of scissor, just a thinner scissor for smaller tissue, different, you know, not as big and as aggressive. The next thing we have are the blistered banded scissors, and we use those usually if we're trying to cut the uterus. If they're going to cut the uterus a little bit more, once they get in there, they'll use those.
Okay.
Because they have no point at the end, kind of like to help
protect
guide.
the tissue.
Yes. The last thing we have on the stringer is the ring forceps. We can also use these for if you put like a sponge in, they come sponge sticks, but we use them for on the uterus, just kind of clamping down to hold bleeders. Sometimes we use it to help tug along the placenta to come out. So we have 4 of those. The next thing on the list is our knife handles. All right, we have 2 different sizes. We have the number 3 and the number 4. The number 3 you use a 10 blade on, and the number 4 you use a 20 blade on. I usually use the 20 blade on for the skin, and then the 10 blade for the uterus. The next things we have are our different forceps. The first one we have is Adson's tissue forceps with teeth. And you can see they're very small teeth, but they're there. We use those whenever we're closing up the skin a lot because they can kind of help.
More delicate.
Yes, delicate tissue, and they kind of hold on to it. Then we also have the Adson's without teeth. We don't use those a whole lot. And then we have the dressing forceps without teeth. So if they're like taking down the bladder flap at the uterus, they'll use these because it's not going to hurt anything because there's no teeth in them. The next thing we have is the tissue with teeth, and they'll use those on spots where they just want to be able to grab onto something and hold on to it. So those are the ones without teeth and one with. Dressing forceps and then forceps with teeth. The next thing we have is the Russian. They use this a lot of times whenever they're closing the uterus to kind of hold on to it. It has a little bit of a grip to it, but it doesn't have as big of teeth as some of the other ones do. The last thing we have for forceps is the Ferris Smiths. They also have big teeth on them. A lot of time they use these for the fascia to kind of grab onto it and really hold on to it because that's a important layer. So those are all the different forceps. So the next thing we'll go to is the retractors. So we have the male abdominal retractor. This one. They'll use this for bladder, holding on the bladder, things like that. We don't use them a lot anymore because we have the Alexis, but they're both used for holding down as a bladder blade. And then this one is called a Dali. This is the Simpson abdominal, what do they call them? The Simpson retractors. So forcep retractors. So there's two different pieces. You count it as one, but usually they'll take it apart and just kind of help guide the baby out. We also use these in vaginal deliveries, and these are open ones because they have an opening, and there's also closed. The next thing we have are the Army Navies. There's two different ones. These are usually used for retracting on smaller patients. And then we have the Richardsons. We also have two of those. These are used for usually bigger patients as retraction. And the last one we have is the Goulet, and we use that a lot of times just as retraction, holding down things. We use this one the most often, and it's called the Goulet.
Thank you.
You're welcome.